Greetings, folks, and welcome to AANMC's May webinar. Are you ready to be empowered? We are talking empowerment today. So with us is Dr. Shama Patel. I am Dr. Joanne Yanez, the Executive Director for AANMC here. We also have Angela Whisker and Stephanie Sandstrom, who will be assisting with Q&A and managing any questions you may have during the webinar. Next slide, Dr. Patel. So I just want to cover a little bit of housekeeping. Thank you. So everyone here is in listen-only mode. Welcome. We are excited for today. We'll be talking all about fertility and how naturopathic doctors address that. If you do have questions during the course of the webinar, we ask that you please use the Q&A function to do so. It helps us track questions a little bit more easily. The forum is being recorded. We will share the link to the recording when we are done. And if you have any issues or difficulties during the course or afterwards, please email us at info@aanmc.org. And so with that, I'm going to introduce tonight's speaker. We have with us Dr. Patel, who hails from Georgia. Dr. Patel, I'm going to leave it to you to take it over. And thank you so much for joining us this evening.
Thank you for having me. It's great to be here. So next slide here. So I'm Dr. Patel. I went to Emory University for my undergrad. Medical school was at National University in Illinois. And I did most of my naturopathic fertility training with Dr. Jacqueline Smeaton and Dr. Mama Simmons. And I've recently just become certified in spinal flow technique, which we'll talk about probably at the end of the program. I don't have any disclosures to report today. And this is our agenda for today. So we're going to talk about the role of naturopathic medicine, the importance of it, understanding infertility, some common causes of it, and some naturopathic approaches that we can take, and then 2 cases. And we can't talk about naturopathic medicine without starting with the V's. So we recognize that the healing power of nature and our body's innate ability to heal itself through life force energy is such a core principle in naturopathic medicine. And I think that's what makes it so important, because we are looking to identify and remove obstacles to health by honoring that innate force. And taking that into consideration, we can say that all diseases are a manifestation of the imbalances caused by those obstacles to health, or what we commonly call root causes. So if we look at infertility through that lens, then we can use a therapeutic order to really understand the underlying imbalances. And taking it back to life force energy and fertility, life force energy is considered to be created at the moment of conception, and it reflects the health of the egg and the sperm. And that's why I think naturopathic medicine is so important for the fertility journey. And I like to explain it in this way. So the first step in a plant's life cycle is a healthy seedling sprouting. A high quality seed will sprout with ease, but only if we optimize its environment. So think of the soil, water, humidity, temperature, nutrition. And naturopathic medicine helps to optimize egg and sperm health while also providing the essential elements needed to cultivate optimal health and to create the ideal environment for new life to blossom. So naturopathic medicine is holistic, right? So we look at the physical, the mental, the emotional, the environmental. So it takes a comprehensive approach. It helps to understand what underlying causes there are by doing further investigation, like vaginal microbiome testing, nutritional deficiencies, looking into things that are causing inflammation or oxidative stress in the body, genetic variants, hormone imbalances, and more. That allows us to offer a more individualized care. So we'll go into more later for that. And we address the health of both partners equally, which I think is really important because you don't always get that. And the natural therapies that we use, like herbal remedies, acupuncture, nutrition, lifestyle modification, they often are more gentle on the body and have fewer side effects compared to conventional outcomes or conventional treatments, which makes it more suitable for patients who are looking for more natural approaches to fertility and patients who are more sensitive. It's a great complement. It's complementary to conventional treatments. So integrating naturopathic approaches with conventional treatments like IVF or IUI can enhance the outcomes and improve response to treatment and also reduce the side effects of those treatments. My favorite one is the empowerment one, because we empower and we educate. So naturopathic doctors empower patients to take active roles in their fertility journey by providing education, the guidance, the support. They're encouraged to make these lifestyle changes and adopt healthy habits, and they participate actively in decision-making regarding their care options. And that fosters a sense of empowerment and ownership over their fertility care. And I think that's really important because the infertility journey can be quite disempowering. And then we recognize the impact of stress on fertility, and that allows us to incorporate different types of stress management, whether it's mindfulness, meditation, yoga, relaxation, even walking in nature, grounding, Reiki, if the patient's open to that. These are all kinds of interventions that can create a more conducive environment for fertility and all other types of health, really. So patients tend to seek naturopathic medicine support for fertility because they want natural support to conceive naturally. That's one of the first ones. And then we have people who come because they've had multiple failed IVF cycles, and they want to optimize their health before their next IVF cycle, or they've done their research and they want to get the help before starting that journey. Sometimes it's secondary infertility, and usually they want to understand the root cause of their infertility. And I think in terms of fertility, with naturopathic medicine, it gives us a really unique opportunity because we can go through the entire cycle, the entire journey, starting with preconception through pregnancy and in postpartum, and we can fill in the gaps. Most of the appointments for those 3 stages are in pregnancy, and then they start lacking in postpartum. So I think naturopathic medicine has a really great opportunity to step in and fill in those gaps, starting with the preconception aspect. And a lot of my fertility clients actually will stay on with me through the entire journey as adjunctive care because they want to stay healthy and they are planning more children as well. So if they've already experienced primary infertility or secondary infertility, they want to be proactive about that. So let's deep dive into infertility. Infertility is the inability to conceive or carry to term after 1 year of unprotected intercourse. Secondary infertility is the inability to conceive or carry to term after previously giving birth. According to the CDC, the prevalence among heterosexual women in the US aged 15 to 49 years old is about 19%. And 6% for secondary infertility. If we narrow that range to 30 to 39 years old, that goes up to 22% who struggle to conceive their first child. That's pretty significant. And just a caveat, the CDC information is on heterosexual women only, not on same-sex partners. For the World Health Organization, that 17.5% of the adult population worldwide experience infertility. So there's definitely a need for that kind of support. The current options are assisted reproductive technology, IVF and IUI, for example. And it's a great technology, right? It's great to have that option. It's helped a lot of people have families. The problem is that on average, it can take 2.5 to maybe 3 cycles to have a successful outcome. It's not often covered by insurance. Sometimes it is, but they'll cover one. If you're lucky, it'll cover more than one. But chances are you're going to spend $15,000 to $30,000 per cycle. And then there's new laws regarding embryos and around abortion that can actually impact the access to IVF, and also raises the question of what to do with remaining frozen embryos. So a recent thing that happened in Alabama, where frozen embryos can be considered children, actually had them shut down the IVF clinics short term because we didn't know what to do with the frozen embryos. This is where naturopathic medicine can come in, because giving that comprehensive approach to optimizing fertility in both partners can improve outcomes, So we're on the financial side, we're reducing the number of IVF cycles, IUI cycles, or not even needing to go down that route in some cases. So you have better IVF and IUI outcomes and natural outcomes. And then also possibly eliminating unnecessary cost of cryobanking, because supporting natural conception and IUI, so then they don't have to have an egg retrieval for an IVF cycle. And a lot of partners are choosing that route because they're trying to avoid the egg retrieval. So female factor infertility is 35% of infertility. Male factor is 30%. Combined factor would be 20%, and unclassified or unexplained is 15%. Although the 15% is estimating to be closer to 40, which is surprising. But looking at the 35 and the 30, we can see that female and male factor are essentially 50%, right? It's half and half. Some of the female factor includes hormone imbalance, hypothyroid, ovulatory disorders like PCOS, anatomical issues, endometriosis. Male factor will include low sperm count, poor motility, abnormal morphology, and other issues affecting sperm quality, like low testosterone, for example. So some approaches that we take in naturopathic medicine, the baseline is going to be diet and nutrition. We want to focus on that foundation, and we can also individualize their dietary goals or recommendations based off of, let's say we do a food inflammation test or food reactive test, and we can personalize it to them according to that, or their blood sugar or whatnot, and also their micronutrient deficiencies. We'll use herbal therapies and supplements to enhance imbalances, for example, enhancing ovulation or regulating hormones. We can look into microbiome testing, GI microbiome testing that will help us understand, are they digesting and absorbing their nutrients efficiently? Are they eliminating their excess toxins? And are they eliminating like their estrogens or their the phase 3 detox pathways that working well? Inflammation, we can see if there's inflammation going on in the GI that could be affecting absorption of nutrients and contributing to overall inflammation in the body, and then intestinal permeability. We also look into vaginal microbiome health, which is something I've been doing. It's a newer thing I've been doing the last year. And vaginal health, we know, impacts sperm survival, and the microbiome is connected to uterine microbiome, which can support or affect implantation. So just to reiterate that in naturopathic medicine, we're going to address both sperm and health quality. I usually start with detoxification, and that's the body and the environment. So educating on endocrine disruptors and toxin byproducts that is in their day-to-day life, whether it's in their cooking appliances or fragrances, air fresheners, what's it called? I don't even use it anymore, so I'm forgetting the word. What you put in the dryer, dryer sheets. Those things all have little toxins that can bog down our detoxification pathways. So we teach them how to declutter or detox their environment, and then we put them through a detox. Supporting them nutritionally, making sure that they're eating the right nutrients and the right amount. Oftentimes I'll see patients come in and they're actually on the lower calorie side, and that can affect hormones and cause a hormone imbalance. So you want to make sure they're doing food log so they understand how much they're eating and what's right for their body to stay healthy. Then we can look into, I talked about the vaginal microbiome testing. It can play a role in recurrent pregnancy loss and endometriosis. So that's why I like testing that on everybody. Micronutrients and beneficial antioxidants, because sperm and egg are very, very sensitive to oxidative stress. So we know antioxidants are going to be supportive, and I want to know which antioxidants are the best for that person's body. Genetic testing can be helpful, like vitamin D receptor variants, MTHFR, other variants that can affect their detoxification, methylation pathways. Semen analysis, which we'll talk about a little bit more in a few slides. And urine hormone metabolites is another testing that we can do to uncover underlying imbalances. Basal body temperature is a great way to find out if there's other underlying imbalances going on. It helps the patient understand how to track ovulation, but it's more than ovulation. It helps them understand their hormonal cycle. A lot of times when I ask them if they know how long their cycle is, they think about their bleeding phase and not the entire cycle. So this is a great, I feel like the basal body temperature, when the patient starts tracking it, that part is empowering because they're getting in tune with their body. They're understanding what cervical mucus means and how it relates to their ovulation. And then they can track their ovulation better without the tedious task of using ovulation strips. So some causes of female infertility that we'll talk about, PCOS, we can look at it from a different perspective and identify which type of PCOS they have. So whether it's insulin resistant, post-pill inflammatory, or other, which I also label as adrenal. And then based off of that, we can support them with nutrition and herbal supplements or tinctures, nutraceuticals. The most common ones you'll see are N-acetylcysteine in that 40-to-1 ratio, myo-inositol to D-chiroinositol. And then we're going to talk about resveratrol a little bit later. Endometriosis is another common female factor for infertility. And again, all of these we're going to start with the foundation. Right? We're going to start with diet, nutrition, lifestyle factors that's going on, but then we're adding in nutrients that could be supportive. So resveratrol is one that can help with endometriosis, vitamin D. Oftentimes you see vitamin D deficiency in endometriosis. We'll look at estrogen pathways to support estrogen detox. Use melatonin is a great antioxidant for endometriosis, and PEA and ginger can be helpful for managing pain. And then the vaginal microbiome for testing. So for male factor, we're going to look at the same analysis, and I usually use the parameters that's on the 1999 reference values from World Health Organization. For sperm health, we're really looking at what's causing imbalances in sperm health. So inflammation, high blood sugar, oxidative stress, low testosterone, varicoceles, nutrient deficiencies, all those things can affect sperm health because of the oxidative damage aspect of it. Omega-3s can be helpful in supporting low count, low motility, and low morphology. Carnitine and CoQ10 can be helpful in motility and morphology. They're great mitochondrial support. Selenium combined with N-acetylcysteine can help improve count, motility, morphology, and testosterone. And then ashwagandha helps with testosterone, but also, as we know, it's an adaptogen. So it helps with the adrenals, but also helps with the testosterone levels. And just to go back to the high blood sugar, that one always catches my patients off guard. And like, how does blood sugar affect my sperm count or parameters? But with a high blood sugar, they found that men who have higher levels of blood glucose actually can have higher levels of sperm DNA damage. So that's DNA fragmentation. And when that happens, there's a higher chance of, there's increased likelihood of pregnancy loss. So these are the sperm parameters by the World Health Organization. In 1999, their reference range was the 50th percentile, so to the right of that orange box. And then in 2010, they decreased it down to the 5th percentile. So in 2010, some men who were listed as or qualified as infertile were now reclassified as fertile status, just based on semen analysis alone. That can lead to fewer men getting referred for proper infertility evaluation. I mean, that's a striking difference, right? Going from 50th to 5th. You were infertile before and now you're fertile, just based off of these numbers. So I think a lot of times the male factor gets lost in this picture. And then I'll also tell my patients I'm a bit of an overachiever, so I'm going to try to get you to the 50th percentile as much as possible, even if you're in the 25th. Now, is there scientific support for natural medicine? Yes. So there's a study, I think in University of Surrey, that they found natural fertility approach with lifestyle modifications, diet, nutrition, nutraceuticals actually resulted in a successful pregnancy rate of 80% in couples with a history of infertility. And then I'm actually seeing that in my practice too. And then there's strong evidence that complementary treatment with an appropriate nutraceutical improves the natural conception rate of infertile couples and increases the success rate of assisted reproductive techniques. So that with IVF, IUI, right? So naturopathic medicine, natural approaches can help improve your IUI, IVF success rates. Okay, so let's talk about some nutrients and labs. I feel like everybody is waiting for those slides. It says a few of my favorites, but it's quite a long list. It's hard to pick your favorite ones because every case is going to need different nutrients, right? And it's very individualized. We will talk about the resveratrol, CoQ10, and I think melatonin and arginine down the line. Some of my favorite testings outside of the foundational labs that we do for hormones would be micronutrients and antioxidants, hormone metabolites and cycle mapping, vaginal microbiome, testing for inflammatory foods, and genetic testing. I don't always do the genetic testing right away. Sometimes they come with results, but we'll add it in if I'm noticing a lot of high markers like high homocysteine and definite B12 deficiency, or if their hormone metabolite test is showing me that they're not metabolizing their nutrients well or utilizing their B12 and folate well. So let's talk about resveratrol. This one, so resveratrol is a great antioxidant, protects against oxidative stress. It can improve ovarian function by activating telomerase activity, which I thought was really cool, and supports mitochondrial function. Because it supports mitochondrial function, it can also improve sperm motility. Now, oftentimes the same nutrient can be beneficial for both egg health and sperm health, but at different dosages. So for resveratrol, that's one of them. Low dose is better for sperm motility. And the reason why it's helpful is because eggs and sperm will have abundant mitochondria. And that's a theme that you're going to see throughout. It comes down to they have a lot of mitochondria. So supporting that mitochondrial health is beneficial. And then resveratrol is really beneficial for endometriosis as well. It helps downregulate a pathway in the endometrial cells that can prevent unwanted changes in the endometrial cells. That improves that uterine lining and optimizes it for implantation, embryo implantation, and for the placenta to form. CoQ10 is quite the popular one. CoQ10 actually declines with age, and it's a very strong antioxidant. It helps against oxidative stress. It's abundant in sperm and eggs, surprise, surprise, due to high mitochondria. They have high energy requirements, right? It improves egg sperm health, which leads to higher fertilization rates, and it can improve ovarian response when there's a low AMH, so low ovarian reserve. So we'll see most patients will come in at least knowing about CoQ10 because they're all researching, they're all learning, and that's one of the top ones that we talk about in the fertility world. Melatonin is another popular one. A low dose melatonin has a great radical scavenger effect. So low dose melatonin is an antioxidant, helps prevent ovarian aging, supports early embryo development, and it can improve IVF embryo transfer outcomes. So those CoQ10 and melatonin are well known because fertility clinics also know about it, and so patients are already familiarized with it, with both. Okay, vaginal microbiome testing. So like I think I mentioned this earlier, I've only been doing my vaginal microbiome testing for about a year, and it's staying in my practice. when we do vaginal microbiome testing and we find the non-lactobacillus dominant microbiome, that suggests dysbiosis, so an imbalance in that vaginal microbiome. That will have a negative impact on implantation in assisted reproductive techniques. It also plays a role in the development and progression of endometriosis because vaginal microbiome is connected to endometrial microbiome. So it's beneficial to test in cases like endometriosis, recurrent pregnancy loss, because of the effects on implantation. So micronutrient test was another favorite of mine. And we look for arginine is one that's on the micronutrient test. When we see thinner uterine lining, I often see low arginine. So arginine can help with that uterine lining, which will help with implantation. You need a nice thick layer, not too thick, but just right. And it can also help with sperm motility. Folate and B12. We talk about folate a lot in the fertility world for neural tube defects, but it's more than only neural tube defects, right? B12 and folate are important for DNA, for regulating DNA methylation. So when there's a deficiency, it's going to impair cell division, which can lead to impaired spermatogenesis and embryo development. And then that can lead to pregnancy loss. Vitamin D receptors, there are vitamin D receptors throughout the reproductive tissue. So we always want to look for vitamin D deficiency and support them there. Vitamin D is a great immunomodulator. So for autoimmune cases, it helps with that immunomodulatory effect, and it's a great antioxidant. Zinc can help with ovulation and with surprisingly cycle regulation too. N-acetylcysteine, that's one a lot of people are aware of as well. It's very effective and can help improve pregnancy rates in IUI cycles. Excuse me. I'm sorry. I'm getting a little bit of a sore throat today. So NAC we also see commonly given in PCOS because it can help with ovulation. It's also beneficial in unexplained female infertility, and it can improve testosterone when taken with selenium, which will improve sperm parameters. Oh, I feel like I'm flying through these. All right, so case one. This is on low AMH. So Mr. and Mrs. H were trying to conceive for about 14 months. They already gone down through the fertility clinic to get their workup done and found low AMH for her age. They did not want to try Clomid or IUI first. They wanted to try natural support first and then go down that route. So Mrs. H, the symptoms that she presented with were constipation, which makes me think, okay, that's phase 3 detox. How is she's eliminating those toxins, which means they're recirculating in the body. So she definitely will benefit from a detox. And then irregular ovulation, painful periods, and eczema. So we did testing and found low testosterone, high estrogen, high gluten reactivity, Giardia parasite, which you would not think that from her constipation picture, but it was there, and she, believe it or not, got it from her dog. So the dog got treated as well, and elevated liver enzymes, B12 deficiency, and her AMH was 1.15. Her 7-day post-ovulation test, post-ovulation progesterone was 12.4, which is great. That's, I would say, is optimal, in optimal range. So we corrected all the other underlying issues, addressed her food inflammation. I think we did more food inflammation testing after that. Her ovulation as well. And then Mr. H, he had abnormal sperm morphology, high homocysteine, high glucose. He had a deficiency in copper, in inositol, cysteine, and lipoic acid. So he worked on regulating his blood sugar. We worked on his copper intake. I think we did that through supplementation. I worked on getting his homocysteine down by giving him glutathione. address his inositol deficiency, his cysteine with N-acetylcysteine, and lipoic acid, which lipoic acid is a great antioxidant. So after correcting those underlying imbalances, she went back to the reproductive endocrinologist. Her AMH was still 1.15. And they told her that she would likely need 3 egg retrievals to get 1 embryo per egg retrieval because they wanted to have 3 children. We did naturopathic support prior to her first egg retrieval, and she got 6 viable embryos. And then their first embryo transfer was successful, and they're actually about to have their baby this month in a couple of days, like 3 days. So that's her low AMH, and that's how we can incorporate, or what's the word I'm looking for, integrate naturopathic medicine approach to IUI and IVF for a successful outcome, right? So just to give, if you don't know, just to give you kind of a back, not story, but understanding of AMH, when it comes to IVF, when you're less than 1 or closer to 1, you're a poor responder to IVF. So this was kind of a rush because her AMH was a 1.15. That's why the reproductive endocrinologist was thinking it was going to take more than 1 egg retrieval, just because of response. Case 2 is a recurrent pregnancy loss. Mr. and Mrs. G, they were trying to conceive for about 3 years. They've had 5 unsuccessful IUI attempts and 3 miscarriages between 6 to 10-week gestational age. They were planning to start IVF, but they wanted natural support to improve their outcomes because of the 5 IUI attempts. And they were actually in the process of egg retrieval. I think they had it scheduled, and they wanted to get it done within a month of starting the detox. And I'd recommended them wait because with the detox, you're going to release a lot of free radicals, right? And we don't want that affecting sperm and egg health. So we always ask them to wait about 3 to 4 months after detox to try to conceive because we want to give them the most optimal chances. So they did end up waiting. So Mrs. G, she diagnosed with multiple pregnancy loss, unexplained infertility, PCOS. She had a lot of fatigue, frequent UTIs, brain fog, acne, poor sleep. She was already on a lot of great supplements like inositol. She already tried adjusting her diet for PCOS, and then also taking inositol, vitamin D, CoQ10, melatonin, zinc, B12, and folate. Her labs showed low testosterone, low estrogen. She was deficient in iodine and arginine, which we talked about for the endometrial lining, glutathione, lipoic acid, and omega-3. So a lot of anti-inflammatories and antioxidants here. She was showing low conductivity. So we wanted to work on her phase 2 estrogen detox. And then she had a higher inflammatory estrogen pathway. So we're working on that. So she had that higher inflammatory estrogen pathway, and she was also deficient in glutathione and cysteine. And cysteine is a precursor to glutathione. So it was just, we needed to support all aspects of that. And then we also did vaginal microbiome testing on her, which revealed a significant dysbiosis. Mr. G, he had fatigue, brain fog, mental exhaustion, trouble concentrating, anxiety, and he also had a high level of stress, which can contribute to all of the above, right? His labs was showing high cholesterol, elevated liver enzymes, low range testosterone, vitamin D deficiency, and B12 deficiency. He also had a glycine deficiency, arginine, selenium, and lipoic acid deficiency on his micronutrient test. Despite that, his sperm parameters were in that 25th to 50th percentile. But like I said, I'm an overachiever. So every parameter that was in the 25th, we were trying to get it up to the 50th, while also addressing just his whole health, right? Getting his cholesterol under control, getting his liver enzymes under control, improving his B12 and his vitamin D. So we corrected those imbalances, but at this point, we actually didn't have the vaginal microbiome results in yet. They did get pregnant around 5 and but they had a loss around 5 weeks gestation. They were really close to the detox. Like it'd only been 1 month or so since the detox, and we didn't have the vaginal microbiome results yet. So we kind of recovered for a month and supported the body, continued doing what we're doing in nutrition, continue what we're doing with diet. And then we did the vaginal microbiome test, did that protocol. And soon after they did the vaginal protocol, they ended up canceling their egg retrieval because they got pregnant naturally. And they made it past 20 weeks, and they're actually going to welcome their child next month. And I actually just talked to them last week, and they're doing great. So what I love about naturopathic medicine is the empowering aspect, right? We help patients take control of their health and give them a voice in their health, right? And participate in their health journey. And looking at a patient as a whole rather than a symptom, even when you're choosing a specialty area, right? So if you specialize, you're still going to look at the whole. Another thing I love is that it really does change people's lives. They go from feeling unheard to feeling seen, and they have the quality of life back. And I love that naturopathic medicine just teaches patients how to be in tune with their body, right? How to understand their body's language and how the body talks to them in symptoms and how to connect the dots so they know how to help themselves on a day-to-day basis and understand where the imbalances are. I get asked these questions a lot. Can naturopathic medicine help in these conditions? Short answer, yes. So my future plans, I mentioned earlier that I'm newly certified in a technique called spinal flow technique. So I will be incorporating that into my fertility and wellness programs to help with the whole nervous system balance and help with the stress aspect on the body. And then my goal has always been to open a naturopathic wellness center that provides multiple modalities and holistic providers. So we would have the clinic on one side or upstairs, wherever, and we would also have like a hyperbaric oxygen chamber, constitutional hydrotherapy, IVs, an IV practitioner, yoga classes, Reiki, energy healing, life coaching, whatever we can find that's conducive to health in one facility where people who are not patients can come, but people who are patients can also be a part of that. So advice that I would give to prospective patients, one is how to practice in the unlicensed state or pre-licensed state. I wish I knew how that beforehand, but I'm glad I learned it while I was here. But how to order labs when you're pre-licensed state, how to collaborate with allopathic practitioners when your patients need medications, right? I find that being transparent about your license is helpful, and educating on what it takes to become a naturopathic doctor. Like, what does our education look like? And what does our training look like? And then leaning on AANP as your resource. They have a lot of resources for us to use. And then also saying that, not saying that you treat and diagnose, so staying away. There's verbiage is key when you're practicing in a pre-licensed state. So this is how I practice here. I use a lot of private lab companies. Most specialty labs recognize the ND license, even if you're practicing in a pre-licensed state. There are some state exceptions to that list, and some lab exceptions. The labs that do have the exception, you just need to find an authorizing physician, and then they allow that. Developing a great referral network of providers who can prescribe. I usually will take who my patients have gone to, and if they've had a great result or the great feedback from that person, then I'll add them to the list, because then I know that doctor is open-minded because my patients actually like them. And they're open to natural medicine and everything. So the other thing is having referral templates for patients to take to their primary care doctor and having that open communication to see if they would prescribe. And a lot of times they will, if they understand why we need it and they look at the labs. They may need to run their own labs, and then they may come to the same agreement, the same decision. I'm very, very transparent about my ND licensure, and that I'm in a pre-licensed state, and it's actually part of my paperwork. So patients sign that in their consent form that they know where I'm licensed and that it's a pre-licensed state. So I can't practice to my full ability. And I've never really had a problem with that. I do require patients to have an established primary care physician because of that. If let's say they need an emergency or they need an emergent like medication, then at least they have someone that they can refer to. And then again, I don't say that I treat or diagnose my treatment plans or care plans, not treatment plans or recommendations. So I think practicing in a pre-licensed state is different, but it's definitely doable because I'm doing it. And one of the benefits is, to me, is not having to deal with insurance, honestly. I still take HSA and FSA, but oftentimes if patients ask me if I take insurance, they're okay with my answer that we're in a pre-licensed state. So since there's no regulation, I can't take insurance. That's what I say. So the future of naturopathic medicine, I feel like as a society post-pandemic, more and more people are becoming health conscious and they're looking for natural therapies to stay healthy. And there's so much information out there, and there's honestly only so much information that they can get off of TikTok and Instagram without having the guidance from an ND. So I'm actually already seeing that new patients that are onboarding, they've already done their research, right? They're open to learn and they realize that they need someone to guide them and walk them through their journey, do specific labs, more detailed interpretation on their labs to find out if they do in fact need that superfood or antioxidant that's blowing up Instagram right now. And then the recent limitations on access to IVF, I think is going to change the way naturopathic medicine works for fertility. It's going to increase the demand for it. And that's my contact info. So feel free to reach out. I think my Instagram's on there. At any one of those places.
Thank you so much, Dr. Patel. This was really fabulous. Fertility is one of those areas that impacts so many people, as you pointed out, and oftentimes people don't feel very empowered. So I really do appreciate your sharing all of this information today, and hopefully it's made a difference for some folks just understanding what their options are and understanding how naturopathic doctors help patients along all of their different types of journeys in life. Can you go to the next slide really quickly? So before we go to questions, I just want to give a quick plug for our upcoming events. In June and on the 12th, we have a panel of alumni from all of the different programs, and they will be here to answer all your questions about how do you become a successful ND? What does that look like? What do their practices look like? All of those things, how they make it through school, etc. And then the following month, we're going to have Dr. Turner speaking about financial success as a naturopathic doctor. So if you have questions about how you pay off your loans and what what successful practices look like, please don't miss our July webinar. So those are our upcoming events. Next slide. And our contact information for AANMC is also here as well if you have any follow-up questions. So we're just going to take a few questions now before we wrap up for the day. So Dr. Patel, there was one question about your case. Was IUI considered in case one?
In case one, no, they went straight to IVF because her AMH was 1.15.
Thank you. And just a question about the CoQ10 choices that you use. Do you prefer ubiquinol, ubiquinone? How do you choose your supplements?
So I use ubiquinol because that's where most of the training that I've gotten is always focused on ubiquinol. Although I have seen some studies where they use ubiquinone. I've just always learned that ubiquinol is more bioavailable or more active. Mhm.
Thank you. And for those of you asking for dosages, unfortunately, we are not giving out dosage information in this type of a format. We don't want people self-prescribing. So if you do have questions regarding dosages, we definitely recommend that you go and see a naturopathic doctor yourself and make sure that you're getting the right the right care for you. As Dr. Patel shared, and naturopathic medicine is very individualized. There's no one size fits all for all people. And so we highly recommend going and finding an ND if that's the route that you would like to go. So the next question, does NAC lower testosterone in women with PCOS? I know you talked a bit about PCOS and its impact on fertility. We have had actually forums just on PCOS and documents that we put out just because it is such a prevalent issue for so many.
I actually don't know the answer to that question. I use an endocrine assistant a lot. I don't remember if it directly reduces testosterone, but I think it indirectly does because it's optimizing ovulatory function. And NAC is helping with the inflammatory load as well. So whatever is contributing to PCOS is going to help balance that out.
Okay. So there's a question here for patients who have been compliant, done all the things, and you're still not seeing their hormonal levels changing. What do you suggest next?
They've done all the things in terms of diet and nutrition.
All your natural suggestions. So they've tried all of the things that you're recommending.
If we've tried everything.
How long do you recommend before they go on to another option?
So I usually work like about 5 months, but it depends on the amount of hormone imbalance. Sometimes if they have really irregular periods, it can take longer to regulate the cycle. But if we're noticing that they're not showing any improvement in hormone management, I usually have them go get their workup done if they haven't with the fertility clinic, and then see if they're qualified for IVF or IUI, because then we likely do need to do a medicated cycle. Right, a medicated aspect.
Thank you. Can you speak a bit more to your vaginal support protocol?
So for the vaginal support, we're going to look at what type of bacterial imbalance they have, and it's usually focusing on doing higher amounts of lactobacillus because that's the predominant type of bacteria in the vaginal canal. And unlike the GI microbiome, you don't want a diverse microbiome in the vaginal canal. That's dysbiosis. You want higher lactobacilli because that's going to help create that healthy pH for the vaginal canal. So we'll do suppositories. Also do oral probiotics at the same time as a suppository probiotic. And then sometimes we'll use medication too. The test that I use will also test antifungals and antimicrobials. So if we want to use a prescription medication aspect option, we can do that. Otherwise, there's herbal routes that we can do as well as a suppository.
And thank you. Last question. So this is always tricky. There are botanicals that are contraindicated in pregnancy. How do you address, so if those botanicals, you're using them for the pre-fertility phase, how do you address maybe botanicals or other therapies that might be contraindicated in pregnancy? And, for how long do you tell folks to get off before they actually try to actively conceive? How do you work with that?
So I usually will I usually recommend they stop once they have a positive pregnancy test. When they're in the program, the goal is that they're not trying to conceive. It doesn't always happen, but that's the recommendation. I don't often use high doses of herbs that are contraindicated in pregnancy early on, like in preconception. But if we do, then I'll have them stop as soon as they're about to start trying or positive pregnancy test.
Thank you. Well, with that, we're going to wrap up today. I'm really appreciative of all of you coming today and listening. And Dr. Patel, thank you again. You're a trooper for joining us on the verge of feeling not so well. So I really appreciate you for being a consummate professional here. And thank you so much for sharing your knowledge.
Thank you for having me. This was great.
All right, with that, we're going to wrap up today. Please check your emails in the next day or two. You will be getting a recording of this in your inbox, and hope that we see you at another event in the not too far future. Have a lovely week. Bye-bye.